Flooring Center.
Welcome back to San Antonio Living. All right, let's talk to you athletes out there who love to play those high-impact sports. Whether you're in your 20s or older, this is something you need to take care of. It's a condition called Achilles Tendon injuries, and they hurt. But we have the right person in studio to talk to us about it. Dr. Marvin Brown from the San Antonio Orthopedic Group. Hello, Dr. Brown.
Good morning.
Good morning. So Achilles tendon injuries in athletes, it's a lot more common than we think. But who gets these kind of injuries?
Anyone that plays high-impact type sports like football, basketball, baseball, anytime where you have to sprint, it increases your risk of injuring your Achilles tendon.
And so we were talking about athletes mostly in their 20s. What are the symptoms that they feel, and when should they come in to see you?
Most of them feel a pop when it occurs, and then they have a hard time bearing weight on the extremity. You can see bruising and swelling.
Okay, and it's painful.
It's very painful.
You're going to know. And how does age play a role in this? Athletes in their 20s, but then older people, how does that, what's different?
What's different is what's happening to your tendon at different ages. So as we age, our tendons get stiffer, which makes them less compliant if you're pushing off.
Right.
The other thing that happens is you can get a disease in your tendon as you age called tendinosis that also sets you up for ruptures.
And tendinosis is something you do not want to get, which is we were just talking a little while ago. This is not something you want to treat at home or definitely kind of put off because you can develop this. And why do some people do that?
Bulletproof and invincible, you know, couldn't happen to me.
Right.
But if you see the doctor early when symptoms start, it's a lot easier to treat, especially in the older population.
Sure.
And, you know, people are playing sports now into, you know, their 60s and sometimes 70s.
Right. They're still pretty active. And why is it important to get treated immediately as soon as you're feeling the pain? And what is the treatment like?
It's much easier to treat immediately. So if you rupture your Achilles tendon, there's non-operative treatment, which is either a cast or a brace with your foot plantar flex to let the ends of the tendon heal, and then slowly over time you bring the foot up to neutral. If you wait too long, you wouldn't be a good candidate for that.
Right.
And the other thing is, if we're going to fix it with surgery, very easy to fix early.
Okay, so it's an easy fix. And what you're looking out for is the pain behind the ankle. That's kind of where the Achilles tendon is, right? So that's where you're going to feel that pain. So when you see patients, what is it like for them? Depending, I guess, on the condition they're in, how fast is treatment? I know a lot of athletes want to get back into the game quick, but what is the treatment like here?
Well, the quicker we see them, the quicker they're back in the game, and the better repair that your body is able to make.
Okay.
We can go in and fix your Achilles tendon. In 12 weeks, we've got you in physical therapy doing early sports activities.
Right. That's incredible. And the best part is it's not going to lead to later on a tendon tear or rupture, which is what we don't want.
Correct.
Well, thank you so much for being with us today, Dr. Brown. Let me give you guys the information on how to find Dr. Brown, and he is with SA Orthopedic Group. Their number is 804-5400. TSAOG.com is the website. You can also find them on Facebook, the San Antonio Orthopedic Group, or Twitter at the SA Ortho Group. All right, guys.